Go for state.
contracting.
Yes. Well, that's what Everett owned.
Yeah, but his daughter owned it at the time she passed with Jason LeVar. And then they lost the minority status and big bonds out there, you know, they got $2.5 million that they didn't know about. Okay, now we'll reconvene the regular board meeting. And I guess Monty or Sheriff Heck.
It's really, I think this is Troy's item. Yeah,
Yep.
go right ahead, Troy.
I don't. Let me just restart go-to just in case someone felt the need to join us that way. Give me just a second.
Yeah, yeah, just the two, yeah.
Okay.
Well, good morning again. Good morning.
Morning. Morning.
So as the board's aware, I have an employee, a deputy in the office that is unable to perform their duties as assigned. And the anticipation is that this is going to be a long-term absence. We have need to fill that position. I would like to get a deputy back on the road to be doing these duties while this plays out and we come to a final resolution on that. So I'm asking the board for authorization to temporarily exceed my allotment of patrol deputies by one while this situation is pending with the other employee, with understanding that once it is resolved, we will then drop back down to the normal allotment of deputies that is currently there for my office. So when I look at the financial impact of this request, I think it's going to be relatively minimal. We are currently recruiting for another position that's open, so we are in the midst of this recruitment. By the time we finish that and hire 2 deputies off of that list, you're probably looking at mid-December, I'd say. Mid-December, maybe even late December, because you got the holidays in there. So there's going to be pretty much all of 2021 is going to be in the books before we get this person up and running. And I think the board is aware of what the financial impact into 2022 looks like for this situation with the pending employee. So I'd ask that we be able to exceed our allotment of deputies by 1 until we get resolution on this pending deputy, so that we have our full complement of deputies out on the road.
Questions?
Mr. Chair, I'll move for a temporary increase in the authorized patrol deputy count.
I'll second.
Motion been made and seconded. Any other comments or questions? I mean, I think it's a need,
It is,
know,
absolutely.
Absolutely a need.
so,
Correct, it is
Yeah.
a need.
so all in favor?
Aye.
Aye.
Opposed, carried.
Thank you very much, Commissioners. We slide right into the next topic.
Please do. Oh, I'm sorry, Mr.
Here to talk about everybody's favorite topic, healthcare. So as you see before you, we have a proposed contract from Centricare to provide our healthcare to the inmates in the jail through 2024. I think I've explained kind of my understanding of the situation as to how we kind of have arrived at this situation with Centricare, with them basically providing services to us in the jail at a cost that is much less than what their actual output is for their employees. Just to briefly kind of sum that up again, I think that they came into a situation where our previous medical provider had basically bought our business. They bid at a much lower cost than what they were actually seeing in order to get into our facility, and within a year or 2 of that bid, they really weren't able to recover those costs, and Centricare came in and agreed to come in at that bargain basement price. And so our challenge has been trying to get to a point where Centricare feels they're meeting their expenses while also not having to endure astronomical jumps all at once. So in talking with Centricare, we came up with the idea of, well, if we can spread that cost out over several years, that would be more palatable than trying to make the jump all at once. So before you have what is the standard agreement that we have in place now with Centricare, the only real changes to the document are the costs and the term of the document. We're seeing definitely an increased need in our jail as far as medical providers, even though we have reduced our population, which has rebounded now to almost pre-pandemic levels. But even when we were going through a reduced period, we still had the most acute and the most demanding prisoners in our jail. So the staff at Centricare and our staff in the jail definitely still had their hands full dealing with people that had very acute, very chronic health conditions and particularly mental health conditions. So we've definitely kept them busy even in the time where our population has waned a bit. But as I said, our population has rebounded to almost pre-pandemic level with our own inmates. We're not taking any inmates in right now for obvious reasons, but yeah, we're almost back to where we were pre-pandemic. There's no doubt that the increases that are being requested here are steep by anyone's estimation. Nobody wants to look at a cost of anything going up, 20% and 15%. I think that as I tried to lay out in the agenda item I submitted, when you compare this to a comparable contract that we could expect from another provider out there, it's still, even though it's quite a jump, it's still in the range. And actually, if my calculation is true for what their inflated rate would be from the 2019 bid, it's still cheaper than what we would expect out of this other company out there in the industry. So with that, I will stop and allow any questions.
Mr. Chair?
Yes.
Sheriff, if we, if we take the mental health out of this, what are we looking at for, because I think that's the big portion of your area, or of your concern, or the medical needs. If you take that out of the jail, I mean, is it cut down by 40%, 30%, 80%?
So
Roughly?
to kind of answer your question, I'll reference the prescriptions that are written in the jail. Centricare has these reports that they provide to us, and I can put them up there if you'd like. But basically, about half of all the prescriptions that are written in our jail are for mental health issues. 45 to 50%. So you're talking half of the conditions we're treating back there are mental health conditions.
Okay.
If you throw addiction in there, that's another about 4%, so well over half either mental health or addiction issues.
Mr. Chair, just to elaborate on where I was going with this is, I do believe, and I think you're privy to, the Sheriff's Association or the elected sheriffs out there kind of getting together and trying to really head up the mental health side of things and trying to almost consolidate areas to where everybody ships these individuals so they got the care that they need and it's a little bit cheaper on everybody's back. But I think we're out a few years on that. I do believe it's coming. That's the only thing that scares me on a 3-year deal is I think some of that money could be directed towards a facility, a joint facility like that later on.
Sure. I do agree that is something that's probably out in the future that we're working on. I should point out, even though it's a 3-year agreement, our Assistant County Attorney, Michelle Meyer, is very good about watching out for our interests. So there is a clause in here that says if we give 90 days notice, we can opt out of this, as can Centricare. So even though it's 3 years, 90 days notice is all that's required to opt out.
That helps me.
I was just gonna say your question's coming.
Is that, option out like 90 days prior to end of the year?
No, it's just 90 days
90
notice.
days period.
Either party can exit the agreement.
Okay.
Mr. Chair, Troy, you, a while ago, you came back to us, you wanted to fulfill a RN on the weekends.
Yes.
In the service contract, is that included? Now, I did say that it's 40 hours per week. and it says at all times, have nursing available at all times. I just want clarification.
So I did ask about additional nursing hours on the weekend, and Centricare's position is that, again, they're saying that they're not meeting their costs yet, that they will not meet their costs until the end of this contract. So they're unwilling to commit additional nursing hours without additional compensation. We can, we will see additional mental health hours in this contract. It doubles in the last year of the contract because they recognize the need and have said, well, once we've met our expenses, we're willing to put that in there. But as far as nursing hours, if we're gonna have somebody in here on the weekend, they're gonna hold tight to the fact that it's gotta be increased compensation, because they're gonna have to find a nurse. They're gonna have to, and especially one that's willing to come in and work on the weekends, which, you know, everybody's short employees, and especially when you start putting on those kind of additional parameters, it's gonna be difficult for them to find somebody.
I apologize, but it says having nursing available at all times for triage,
Triage.
Yes.
thank you, and phone consult to assist county jail staff and answer medical questions regarding care of inmates. This may be provided by Centricare Connect Call Center triage. Is that something that is included in the weekends or not? Is that just for the week?
That is the 24/7 service that we get from them. So we have a nurse on staff 40 hours, well, we pay for a little bit more than 40 hours, but basically the nurse is here Monday through Friday for 40 hours. When the nurse is not here, our detention staff has access to this Centricare call line, so that when something comes up, if they have a list of written protocols that they're supposed to follow. And that protocol might say, based on the conditions that you're seeing, you need to call the nursing line so they can have a provider address this. Or the protocols might say, well, give them this medication. It just depends on the condition. But that 24-hour triage is available to us at any time if we have a condition that either the protocols say you should call in on, or if we're just not sure and we want some medical advice. That's what that provision is meant to address.
And then that'll be a NEP charge if we used it on the weekends then?
No, that's included.
That's included?
That's
Okay.
included in this contract price.
Okay.
Mr. Chair, Sheriff, just for clarification, so the big advantage of entering into a 3-year would be to lock these rates in. So if we don't decide to go with a 3-year, it would be a renegotiated rate going forward.
Yes, so the other option that was sent to me is a 1-year contract, and the increase for 2022 is significantly more, because again, it's not spreading this increase out over 3 years. And yes, to your other point, it does lock this in, so we have some certainty about what those expenses are going to be.
Well, and you answered it earlier, the 90-day out.
90-day
That
out,
helps me
yeah.
swallow this a little more. Thank you.
It's still a hefty increase, correct?
Oh, no
Certainly
kidding.
is.
It's a hefty increase, but we have an out, 90-day.
Do have an
And
out.
that's very good. In my opinion, we gotta enter into it, or we can enter into it knowing that we have this out.
Any other questions? I guess the only comment I had is that, they came in and they said they tried to, purchase our business, and you look at this contract and why don't they try and keep our business maybe a little bit?
Oh, yeah.
Yeah.
There's two ways to look at that. I mean,
And just to
in
be
my
clear-
book, it doesn't look like they're trying to keep our business too well.
It wasn't necessarily Centricare that was purchasing our business. I think our previous provider purchased our business, and when Centricare came into the picture, they agreed to do
What they
this
were doing.
for the same price
You're
as the
correct on
previous
that.
one. So
Yeah.
it was kind of a problem they inherited, so to speak. But
Yeah.
Yeah.
Again, from my perspective, I'm not overly thrilled about it, but I can swallow this pill with the 90-day out. And
All right.
we are, quote unquote, locking our rates in, even though they're extremely high.
Yeah.
And if we didn't do this 3-year one, the increase is substantially more
Right.
for
I
this
think
year.
I feel a little bit like we're backed in a corner here.
Pretty much.
I feel like that we've been backed in a corner all morning with all of our issues.
True.
Well, and I don't see these getting any better.
Well-
I mean, you can't find people to work. I mean, you're, I bet you didn't like the 2.5% that we were talking about earlier in Benton County when you got how many open positions over there?
Yeah.
Yeah, that's like,
Yeah, if anybody knows somebody that wants to work in the jail, I'd be happy to.
happy to take them. But they can't pass, most of them can't pass the criminal background check, correct?
Well, that is an issue for some, yes.
Oh.
Issue for some.
Okay, so we heard the request, we got the, before us. Your wishes,
I'll make a motion, go ahead. Nope. I'll make a motion to approve the contract and direct the chair to sign.
okay.
Second.
Motion's been made and seconded to approve the contract. Any other discussion? All in favor? Aye. Opposed? Carried.
Thank you.
Right.
Thanks, Sheriff.
Thank you, Commissioners.
Thanks for everything you did on that.
Thank you.
Yep,
Take care.
Yeah, with all the,
I think that was good, you got to
People
spread out
getting
that,
out
because
of
if we do, even if we do the third.
nursing and
Yeah.
stuff, it's probably
We
gonna
saved
go up
that
even more.
I think that was the end of our, I lost it.
Motion to adjourn.
Second.
Motion been made and seconded to adjourn. We're adjourned.